Hello friends, welcome to the Curious Pharma. Welcome to the next part of classification series, that is part 3b. In this part of anti-cancer drugs, we are going to see the cell cycle specific drugs and non-cell cycle specific drugs. This means in the cell cycle specific drugs, the drugs are acting on the particular phase of the cell cycle like G1, S, G2, M phases. Here in the G1 phase, epipodophyllitoxins, in synthetic phase antimetabolites, in G2 phase topoisomerase inhibitors, and in M phase vinalkaloids and taxanes. In the non-cell cycle specific drugs, the platinum compounds, alkylating agents, mitomycins, anthracyclines. In the further part of this video lecture, we are going to see the complete examples and its mechanism of action and uses of these particular drugs classification. Here comes the first part, that means first classification, epipodophyllitoxins, which acts on the G1 phase of the cell cycle, which is the pre-synthetic phase. Here, these examples are etoposide and tenoposide. The mechanism of action includes the topoisomerase 2 inhibitor. These drugs are topoisomerase 2 inhibitors. Actually, these topoisomerase enzymes are 4 types. Each have their significant action during the cell cycle. Here the topoisomerase 2 have the property of unwinding of the DNA before its replication. For the reading of these codons, should the congested, the DNA is completely supercoiled and placed in the cell. This supercoiled DNA is not suitable for the replication. So the unwinding of DNA takes place by the enzyme topoisomerase 2. When we inhibit this topoisomerase 2 enzyme, the unwinding of the DNA strand does not take place, so that which is not suitable for the DNA replication and stops the cell further cell division. It causes the cell death. Then these drugs are used for the testicular cancer and lung cancer in the males. Next, second part. Here comes the antimetabolites. These drugs are in the synthesis phase of the cell cycle. In the synthesis phase, the drug is gathering. The DNA was synthesized by using the nitrogen bases and sugars. So examples. First one, 6-mercaptopurine, 5-thioguanyl, cytarabine, methotrexate, capecitabine, cytosine, arabinocyte, paclitaxel. Here, if you observe the names of these examples, antimetabolites, you will see purine, guanyl, cytarabine, capecitabine, cytosine, etc. These are somewhat more analogous to the nitrogen bases that are used for the replication. So, this mimics the nitrogen bases and replaces the nitrogen bases during the DNA replication, so that since these are not the real DNA nitrogen bases, they will stop the DNA replication, which causes the undesirable DNA fragment and inhibits the cell division. Here comes the third classification, topoisomerase inhibitors, which acts on the G2 phase of the cell cycle. Irinotecan, topotecan, etoposide, and bleomycin. Bleomycin is used for the melanoma, sarcoma, and testicular cancers. Here comes the fourth classification, vinca alkaloids, which acts on the M2 phase of the cell cycle. Vincristine, vinblastine, and vinorelbine are the examples of the vinca alkaloids. In this, mechanism of action includes binds to the beta tubulin. See, first, what is beta tubulin? Here in the cell cycle, in the telophase, in the metaphase, we will observe the spindle fiber formation. See, here spindle fibers are present. After the replication, all sets of the chromosomes are arranged at the middle. From the spindle fibers, beta tubulin will generate the spindle fibers and attaches to the kinetochore. so that at the telophase these DNA fragments are separated towards the poles of the cell, so that after the cytokinesis these two cells are formed in the at the end of the mitosis. But here when we inhibit the beta tubulin by by forming a complex, this telophase, this separation of the DNA fragments towards the poles does not happen, so that the DNA sorry the cell cycle is disrupted and the cell death causes. It is also called as the metaphase arrest. Here comes the final class of drugs that are involved in the M phase, taxanes. They also act on the M phase. Examples are paclitaxel and docetaxel. Their mechanism of action includes the polymerization of the beta tubulin complex. Here this acts on the same place where the Vinca alkaloids acts, that is the beta tubulin spindle fiber formation. Here since in the Vinca alkaloids we have seen that the inhibition of the spindle fibers, but here there are proliferation of the or increase in the polymerization of the beta tubulin complex in the spindle fibers, so that these beta tubulin fibers are extensively grown and polymerized, so that they are not suitable for the spindle fiber formation. And in the telophase, the separation of the sister chromatids does not take place because of the not undergoing the normal beta tubulin complex formation, so that cell death happens. This is the major classifications involved in the anti-cancer drugs. The further non-cell cycle specific drugs we'll see in the next dedicated video lecture. Thank you.